Hello everyone. Topic for today's discussion is obesity and diabetes. Obesity is major epidemic of 21st century. It has been reported that in most developed countries up to 30% of their population is obese. Nowadays, childhood obesity is an emerging major problem. 1 in 5 children and adolescents in India is either overweight or obese. Obesity affects up to a third of adult Asian Indian, and the number of obesity and overweight population is rising nowadays due to the rising urbanization. As per the various studies in India, it indicates that approx 20 to 50% of urban population is either overweight or obese in India. So, how do we define obesity? Obesity is qualitatively defined as a condition in which the excess fat has accumulated in the body to the extent that it causes adverse effects on the health. Conventionally, obesity can be defined by the BMI, body mass index, waist circumference, or waist hip ratio. However, the body mass index BMI is commonly used among all these three, and BMI can be calculated by the formula, that is weight in kg divided by square of height in meter square. Based on the BMI, individuals can be classified as underweight or normal weight or overweight or obese. Here in this diagram, we can see the WHO categories of BMI, body mass index. There are 6 categories of BMI, based upon which the weight has been categorized. Less than 18.5 BMI, that is in kilogram per meter square, it indicates the category underweight. 18.5 to 24.9 is normal weight. 25 to 29.9 comes under the category overweight, and above 30 is defined as obesity. However, again the above 30 category of BMI has again been divided into 3 categories. 30 to 34.9 indicates class 1 obesity. 35 to 39.9 comes under the class 2 obesity, and more than 40 BMI indicates the class 3 obesity in the person. However, this classification may not be valid for the Asian Indians. It is seen as compared to the Caucasian counterparts, the Indian or Asians, they show adverse health consequences of excess adiposity at much lower level of BMI. And it is also seen that Indians have tendency to develop the metabolic abnormality or metabolic correlates of obesity at low level of BMI as compared to their Caucasian counterparts, and because of this reason the BMI cutoff for the Asians or Indians have been revised, and these are as shown in this table. The BMI between 18.5 to 22.9 is categorized as normal weight for the Asians or Indians. BMI between 23 to 24.9 is categorized as overweight, and the BMI above 25 has been categorized as obese, which is underweight in WHO categories. There is a concept known as thin fat Indian, and this is based upon one of the paradox. As per this paradox, the Asian Indians have higher chances to develop type 2 diabetes as well as cardiovascular diseases as compared to their Western counterparts. However, these Asian Indians have lower body weight and low level of BMI as compared to their Western counterparts. This concept of thin fat Indian is also known as Asian Indian phenotype, and as per this concept of Asian Indian phenotype, for any given body weight, the Asian Indians have higher waist circumference, they have high level of visceral obesity, more chances of insulin resistance, and more chances to develop diabetes as compared to their Caucasian counterparts. And this thin fat Indian says that the thin fat Indian may be physically lean, but they can be metabolically obese. There are two different variety or types of obesity. The first one is android or central obesity. Here the body has shape of apple. We can see in this picture. Here the fat accumulation occurs mainly above the waist, and it is more common in males. However, the second kind of obesity is known as gynoid obesity. Here the body resembles the shape of a pear. Here we can see in this picture, and in this kind of obesity the fat accumulation usually occurs below the waist, and it is more common in females. The apple shape found in android or central obesity, it indicates that there is increased visceral obesity, adiposity, which is an important risk factor for cardiovascular diseases. However, the simple measurement of BMI cannot differentiate between these two types of obesity known as android and gynoid obesity. The central obesity, which is found in this apple shaped body, is strongly associated with the metabolic syndrome, and such kind of obesity has higher risk of development of cardiovascular diseases. For the measurement of central obesity, the use of measurement of waist circumference or waist hip ratio is recommended. And however, out of these two, the waist circumference is preferred over the waist hip ratio because of the point of view of convenience in measurement of waist circumference. Waist circumference measurement in obesity. The waist circumference has been shown to be a good surrogate marker for the abdominal obesity. This waist circumference is measured in a standing or straight posture, and breathing out and wrapping a tape around the waist just above the hip bone. And as per the Indian values, if the value is more than 90 cm in male and more than 80 cm in females, then we can consider this waist circumference as abnormal level. Now let's discuss what are the correlation of obesity and diabetes, how these two are affecting each of other. The obesity is major etiological factor to develop type 2 diabetes mellitus. The obesity, particularly the visceral obesity, is a strong risk factor for development of type 2 diabetes mellitus, and the obesity can also influence the response to treatment in a diabetic patient, and also it has a strong bearing to develop diabetes complications in a patient with diabetes. And it is also seen that few of the anti-diabetic agents have influence to gain weight, and person can become obese or overweight due to consumption of these anti-diabetic agents. In a person with obesity, the diabetes can be developed due to the excess visceral fat, and due to this excess visceral fat there can be increased secretion of the inflammatory mediators as well as adipose cytokines, and due to this excess visceral fat there can be increase in the amount of free fatty acids in the body. This can lead to development of insulin resistance in the person, as well as it can also produce the beta cell dysfunction due to lipotoxicity in such kind of person. Now let's discuss what are the effects of anti-diabetic agents on weight of the person. So the anti-diabetic agents can be classified into three categories. The few drugs are there which can cause the loss of weight in the person. Few drugs they have neutral effect on the weight of the person if these anti-diabetic agents are consumed. And the third category relates with the gain in the weight in the persons. So there are three categories of drugs which cause the weight loss. The first one are metformin, the second one GLP-1 receptor agonist, and the third one are the SGLT2 inhibitors. There are three categories of drugs which has no effect on weight. They have neutral effect on the weight. These anti-diabetic agents are maglitinides, which includes repaglinides and netaglinides, the alpha glucosidase inhibitors, acarabose and miglitol, and DPP-4 inhibitors. The third category of drugs are those which cause gain in the weight, and these drugs are sulfonylureas, thiazolidinediones, and the most famous drug, that is insulin. Now let's discuss what are the health penalties, or we can say what are the health consequences of obesity. So obesity can increase risk of development of type 2 diabetes mellitus, which we have already discussed. It can cause development of hypertension, dyslipidemia, the cholelithiasis. Certain types of cancer are very common in obesity: the fatty liver, the gastroesophageal reflux disease, polycystic ovarian syndrome. It can also cause the degenerative arthropathy as well as obstructive sleep apnea, OSA. It has been reported that if any person becomes overweight or obese at age of 40, then the life expectancy reduces by 3 to 6 years. Now let's discuss the management strategies for the obesity. The management of obesity includes three mechanisms. The first one is lifestyle modification. The second mechanism or method is by anti-obesity medications, and the third method is by the surgical treatment. The overall target, the initial target of our management of obesity is reducing about 10% of the body weight as compared to the present weight, and it has been noted that about 5% to 10% of weight loss can reduce the risk of cardiovascular diseases as well as the stroke. Now let's discuss the first method, that is dietary modification or lifestyle modification, which includes by use of certain weight loss diets, in which the first type is by using low calorie diets. These low calorie diets are high in carbohydrate. These are carbohydrates having high fiber and low glycemic index. This kind of diets are low in fat, as well as these are of low or reduced calorie diet, and few examples of such low calorie diets are NCEP step 1 diet and DASH diet. And such low calorie diets can reduce the body weight by 8% in 3 to 12 months. However, for full benefit in such kind of low calorie diets, this should be combined with the exercise. The second kind of weight loss diet is low carbohydrate diets. As the name suggests, the low carbohydrate, here the carbohydrate will be restricted to 3 to 10% of the daily energy intake, and these diets are high in fat as well as in protein, and the best example of such low carbohydrate diet are Atkins diet. However, these low carbohydrate diets are not recommended because they are low in fiber, low in minerals as well as low in micronutrients. The another type of weight loss diet is very low calorie diets. Here we will consume the calorie less than 800 per day or less than 3060 kilojoule per day, and such kind of very low calorie diets consist of commercial preparations or specific foods having high biological value. However, for such very low calorie diet, the intensive monitoring is needed, very important, and such very low calorie diets are only indicated for severely obese persons which have compelling medical indications to lose weight rapidly. These kind of diets are not useful in maintenance of weight as because we can't continue such diets beyond 16 weeks because of consumption of very low calorie, that is less than 800 per day. This type of diets have some side effects which include the cholelithiasis, the loss of lean mass, the ketosis and hyperuricemia. The another category of diet is very low carbohydrate diet. So here the diet will consist of high in fat as well as in protein, and here the total fat contains approx 10 to 15% of the diet. Example of these very low carbohydrate diets are Ornish diet and pretty keen diet. However, this kind of diet have some side effect as it can lead to hypertriglyceridemia and malabsorption of the minerals. Now let's discuss what are the role of exercise in obesity. It is seen that it is difficult to achieve weight loss by using exercise alone. However, it is seen that the exercise can increase the effectiveness of all the weight loss dietary regimens which we have discussed earlier, and the exercise has more important role in maintenance of the weight loss apart from the initial achievement of the weight loss. Means the exercise is more important in maintenance of weight loss. Now let's discuss the medical management of weight loss or the medications which can be used for losing weight. The orlistat is the only available medication in India for the weight loss, and the main mechanism of action of this orlistat is by inhibiting the pancreatic lipase enzyme and finally reducing the absorption of the fat from the gut. Here in this diagram we can see in normal mechanism the dietary fat is hydrolyzed by the gastric and pancreatic lipases, and this divides or disintegrates into the free fatty acids and monoglycerides, and ultimately this fat is absorbed from the gut. However, when the orlistat is used for the losing weight, this inactivate the gastric and pancreatic lipase enzymes, and because of that the dietary fat is unable to hydrolyzed in free fatty acid and monoglyceride, and because of that there is decrease in the fat absorption approx 30%, and there is increase in the fat excretion from the body. This orlistat can be given in the dose of 60 to 120 mg 3 times in a day. However, this orlistat have some side effects in form of oily spotting, the fecal incontinence and flatulence. However, the weight loss has been seen 3% beyond the placebo, and this orlistat only works when there is at least 30 gram of fat consumption in the diet by the person. However, the other anti-obesity agents, examples are sibutramine, the rimonabant and lorcaserin have been banned in India and these are banned because of the unacceptable side effect profile of these drugs. Now let's discuss the surgical methods or surgical management of the obesity. These surgical management methods are also known as bariatric surgery or metabolic surgery, and the main mechanism of this surgical management are reducing the calorie intake by modifying the anatomy of the gastrointestinal system. This surgical management or surgical methods can be divided in two methods: the reconstructive procedure and malabsorptive procedure. In reconstructive procedure, we will limit the intake of the food by creating a small gastric reservoir with a narrow outlet so that we can delay the emptying of the gastric reservoir. Example of such reconstructive procedures are gastric stapling and adjustable gastric banding and vertical sleeve gastrectomy. In malabsorptive procedure, we will bypass the portions of the small intestine where the actual nutrient absorption occurs. The examples of these malabsorptive procedures are biliopancreatic diversion and proximal ROX and Y bypass surgery. In general, it is noted that the malabsorptive procedures are better. They bring greater weight reduction and improvement in glycemic control as compared to a restrictive procedure. Here in this diagram, we can see how this gastric stapling took place and how this gastric bandings procedure takes place. Here are some commonly used bariatric surgical procedures: the jejunocolic bypass, biliopancreatic diversion, the vertical banded gastroplasty, and ROX and Y gastric bypass. Now let's discuss the indications for the bariatric surgery. So the two different organizations have given various indications for the bariatric surgery as per IFSO APC, which is International Federation for Surgery of Obesity and Metabolic Disorders Asia Pacific. As per this IFSO APC recommendation in year 2011, the bariatric surgery is indicated for such kind of patients having BMI more than 35 kg per meter square, or the patient having BMI more than 30 kg per meter square with type 2 diabetes mellitus or metabolic syndrome. However, as per the IDF, the International Diabetic Federation recommendation, which was given in the year 2011, the bariatric surgery is indicated for Asian patients who are having BMI between 27.5 to 32.5 kg per meter square, and also they are having the type 2 diabetes mellitus, which is not controlled by the medical treatment, and those have presence of cardiovascular risk factor. So what are the benefits of bariatric surgery? By bariatric surgery, we can lose weight of 20 to 40 kg and the BMI can be reduced by 10 to 15%. There can be remission of type 2 diabetes mellitus because of bariatric surgery in up to 76% of the cases, and this is known as the surgical cure of diabetes mellitus. By bariatric surgery, it is seen that there can be improvement in dyslipidemia, there can be improvement in blood pressure, high blood pressure, there is improvement in sleep apnea syndrome, as well as it increases the quality of life in a person with diabetes, and the overall reduction in the mortality can be achieved by the bariatric surgery. Apart from the benefits of bariatric surgery, there are few problems or few side effects with bariatric surgery, as the bariatric surgery has high level of morbidity and mortality. the person going through the surgery. It has also some gastrointestinal side effects in form of dumping syndrome, the anastomotic leak, the bowel obstruction. It also increases the malabsorption of the vitamins, iron, calcium and some other nutrients. The chances or risk of cholelithiasis is also increased in bariatric surgery, and it is also noted that the sum of the weight lost which has been achieved initially can be regained after few days or few months. Thanks for watching this video. Please like and share this video with others.